Dr. Marc Siegel now, Fox News contributor, professor of medicine at NYU Langone Medical Center. So, doctor, I'm going to start with the obvious. It is a little disingenuous, if not flat out something else, for this administration to tell us that they didn't know this was coming in time to at least get a handle on testing. Because we know from the South African president and then today from the WHO, World Health Organization, that at least by Thanksgiving we knew, the 25th of November. Some reports that it might have been earlier than that. Your thoughts?
You know, yesterday, Harris, good morning. I just spoke yesterday to Dr. Wasila Jasat, and she's the public health specialist at the National Institute of Communicable Diseases in South Africa, who's been very vocal about this for weeks and weeks. And she told me, look, this virus, this variant is multiple times more contagious than Delta, and she says that prior infection appears to play a role in slowing it down and giving you a milder case, as does the vaccine. Here's the point. This information has been available for weeks, and South Africa reported on it. Yesterday, they put out the study that proved it, that if you're not vaccinated, your chances of dying are much higher. But it isn't just vaccine. It's also having had prior infection. We knew about this. We've been tracking this. Our own CDC has been tracking this. I talked to Dr. Walensky about this weeks ago. We knew variants were emerging from areas like Africa and India. We knew this. We knew they're going to be more transmissible because that's what a virus does to survive. Disingenuous is the right word, Harris. It's the right word. What we have here is a lack of preparation.
A lack of preparation. So apparently when you point that out, it hurts. Yesterday, the president snapped at a reporter for asking about failure on testing, rather. Let's watch.
What's your message to Americans who are trying to get tested now and who are not able to get tested and who are wondering what took so long to ramp up testing?
Come on, what took so long? If I had told you 4 weeks ago that this would spread by a day-to-day basis, it would spread by 50, 100%, 200%, 500%. I think you would have looked at me and said, Biden, what are you drinking? But that's what it did.
Wow, that tone. You got to save that for Commander, the new puppy. An op-ed in the New York Post calling Biden's claim that Omicron was somehow unforeseeable, quote, total bull. It reads, once Omicron was detected in the 4th week of November, the world went bananas precisely because it was going to spread rapidly. And the president's claim directly contradicted one of his own top COVID advisors. Here's that.
This pace, the speed by which Omicron has been, transmitting has been seen and mirrored in many other countries. And so this is exactly what we anticipated.
Isn't the administration behind the curve on being prepared to ship about 500 million free home tests when we need them now?
Yeah. Well, we're going to hopefully quickly catch up with that curve.
You know where else it's obvious? Where all those Americans are waiting for hours in line to get a test and can rarely find them anywhere in their communities? Dr. Siegel.
Listen, Michael Mina from Harvard has been talking about this for months, and I've been on the show with you weeks and weeks and weeks ago talking about how we needed rapid tests in every home in America. Everyone's heard me say that, and I'm not alone. And the way that the rapid tests occur in every home is the federal government being ahead of this with a public-private partnership pre-ordering to the companies like Abbott, like Quidel, and getting this to happen. 500 billion doses, a test shows they can do it, but they're talking January here, Harris, and then you got to go to that federal website where you probably are going to be waiting for an hour trying to log on, right? That's ridiculous. We need billions of tests. We need them now, especially with a widely spreading variant that everyone could have predicted. You can't get a test, and all there is panic, and that's what contributes to it.
Well, and a lot of people are trying to travel. And if you are going to check into a hotel, no matter where you are, if you're going to get on a plane, you're going to need to have a negative test. And in many cases, regardless of whether you are vaccinated or unvaccinated. So if that's the case now, because it's the holiday season, you're competing with far many people than just might be curious or feeling a little bit sick and want to know if they have COVID. The world is getting ready to travel. They're already into it. Doctor, let's move to this. This big development today. The FDA is reportedly set as early as today to authorize COVID treatment pills both from Pfizer and Merck. You've been telling us about this. You said this is a game changer. Bloomberg is reporting that the two drugs are seen as promising new oral treatments that can be taken upon onset of symptoms to help prevent hospitalizations and deaths. Dr. Siegel, this moves the ball.
Yeah, and I'm going to go on record right now and tell you that the Pfizer drug is much better than the Merck drug. They're very similar to drugs we used for HIV in years ago in the 90s, and the Pfizer drug is a protease inhibitor. That changed the game for HIV, and it looks really good here. And it was just published in the New England Journal of Medicine. Decreases your risk of hospitalization by 90% if we diagnose you early. Again, rapid test in your home. You don't go roaming around looking in a pharmacy somewhere. Rapid test, positive. The pill Paxlovid decreases your risk of a severe outcome, whether you're vaccinated or not. This is the game changer. They've been sitting on it. Now the question is, okay, FDA is going to approve it this week, Harris, but they only pre-purchased 10 million doses. We need not 10 million, 100 million. 100 million.
Yeah, but there are 330 million plus Americans. And look, not everybody's going to need them, but you want a big stockpile. All right, last question for you with where we are right now. You've got the testing that's behind, you know, and it's got to catch up. You've got a variant that looks like, from what South Africa and the UK are reporting, could begin to level off. And then you've got some new drugs. How long does it take to get those things in place that really make a difference? We've got the FDA, but when will they be available through your doctor?
It's not going to be for weeks until it's geared up. And let's talk also about the monoclonal antibody. Right, GSK makes a monoclonal antibody that we need now, not today, not yesterday. We need it this moment. We need the pill. We need the monoclonal antibodies. We need the testing right now. And you're absolutely right. In South Africa, it's leveled off, but a lot of people are infected. One last thing, get the boosters out there now, but not by lecturing. I completely agree with that, with what you said earlier. Let's not demonize people. Let's not mandate people. Let's talk to people, and let's get those shots into doctors' offices, which you and I have been saying also for weeks.
Well,
let me have that conversation. Let me have that conversation, not a politician.
If you're having a conversation with your doctor, it only makes sense. And the federal government might have to help out to have enough people to handle that on site for doctors, but do whatever it takes. Real quickly, the Army has come up with what could be something that can hit all the variants. They say they have a single vaccine to guard against most COVID and SARS variants, but a caveat here, it was not tested on the Omicron variant. Dr. Siegel, what's your take on this?
You know, I'm glad you brought this up because I want to point out something that you and I both love, which is the military. We haven't even talked about this. Their infectious disease division, both at Walter Reed and at U.S. AMRID, Army Infectious Diseases, is top of the world. They're as good as the CDC or better, and they've been quietly researching a vaccine that uses a soccer ball type protein, hasn't been tested against Omicron, but has been very effective against all variants. Still in early trials, but this may be the game changer for the vaccine, where you just need this vaccine and you don't have to keep reconfiguring for emerging variants. This research, very exciting, still early, going into middle stage trials now with humans.
Walter Reed, you mentioned it, and the military.
Walter Reed.
Critical. We'll keep an eye on this part of our coverage. Dr. Siegel, thank you very much. A lot going on with this today.
Hi, everyone. I'm Brian Kilmeade. I want you to do me a favor. I want you to click to subscribe to the Fox News YouTube page. This is the only way that I know for sure that you're not going to miss any great commentary, any great news bites, any great interviews coming your way on Fox. You can get it all here on YouTube. So subscribe right now.